A Central Georgia nonprofit says President Trump's tax law will make it harder for people with disabilities to receive their services. They also say it puts their funding at risk. Olivia Dunn spoke with the organization and to a mom about their concerns.
The light of my life.
Linda Hayes says her son Daryl Jr. is her world. He was diagnosed as being profoundly intellectually disabled when he was a child and also has Lennox-Gastaut syndrome. That's a condition that causes life-threatening seizures. He now lives at a residential program through the Arc Macon. The agency provides activities, employment, and living options for adults with intellectual and developmental disabilities.
He requires 24-hour care, and we are so grateful for the Arc because of the way they provide that for him.
The Arc Macon gets most of their funding from Medicaid waivers that pay for home and community-based services. But President Trump's tax bill passed this month changes the application process for that waiver. Now it requires reapplication every 6 months instead of once a year. Hayes says she supports the bill, just not the hoops that families like hers must jump through.
The world at large sees people with disabilities as non-productive members of society. When we can't get services for them, the whole family becomes non-productive.
Katrina Spooner, Chief Administrative Officer with the Arc, says she fears the changes the bill may bring.
And I don't see the positive impact of this bill, and so that's what makes me really worried.
She says although the change seems small, it's a huge unnecessary barrier for those seeking or trying to maintain care. The more steps in the process, the more likely adults at the Arc are to lose care.
I see this essentially being neglect, because I think that there are going to be more people not receiving care, not because they're not eligible, but simply because they've made it harder to maintain this coverage.
In Macon, Olivia Dunn, 13 WMAZ News.
President Trump calls the tax law his One Big Beautiful Bill Act and signed it on July 4th. The federal budget could also threaten rural hospitals. The American Hospital Association says the budget could cost Georgia's rural hospitals $540 million over a decade. And a University of North Carolina report warns 2 Central Georgia hospitals could shut down: Washington County Regional in Sandersville and Flint River in Montezuma. But earlier this month, the Washington County CEO told us their finances have improved. As for people on Medicaid, some could lose coverage. The Congressional Budget Office said 750,000 Americans could lose coverage by 2035. In Georgia, 70% of nursing home residents, 40% of children, and half of all births rely on Medicaid.